Hi, I'm Frank Diamond, the managing editor of Infection Control Today. President Trump said recently that the worst is still to come when it comes to COVID-19, and many healthcare experts agree. We here at Infection Control Today are trying to help by giving infection preventionists and other healthcare professionals the information they need to fight this virus in the trenches. One of the ways we're doing that is by asking the experts what they think, which brings me to my guest, Maureen Spencer. Ms. Spencer is an internationally known infection preventionist who recently gave a presentation to the World Health Organization about the whole issue of just how SARS-CoV-2 is transmitted. It's a droplet that clings to certain surfaces, true, but it's also airborne, and that makes it somewhat unique among viruses. Ms. Spencer is currently an independent infection preventionist consultant and was previously the Corporate Infection Prevention Director for Universal Health Services. She was also the IP Director at Mass General Hospital and New England Baptist Hospital in Boston. Ms. Spencer, thanks for joining us today.
Thank you, Frank, for having me.
So can you give us a gist of what you told the World Health Organization?
Yeah, it was a very interesting webinar where clinical engineers and infection preventionists kind of came together, and each one of us kind of had a topic to speak about. Mine was on the whole concept of, is this airborne transmission? We had somebody else, Ruth Carrico, was talking about the environment and how to clean this, the disinfectants that can work, and how to clean equipment. Then there was another gentleman talking about how to take ventilators and make them multi-use. So it was really a very fascinating webinar, and it went to 40 countries, I think, were participating. So we got a lot of exposure with it. But my talk was kind of geared towards what we recently, within the last month, have been dealing with, is the WHO being asked by a group of experts, infectious disease doctors, about 239 of them, wrote a letter to the WHO on July 6th. And so this webinar was last week, and I kind of had to wait till the last minute to get all my slides finalized, because on July 9th, the WHO did respond. Primarily, I guess you have to go back to kind of what I talked about is how we look at an outbreak investigation, infection preventionists. We have what's called the chain of infection. So we start off with, what is the agent? So in this situation, SARS-CoV-2, that's the virus that causes the condition called COVID-19. How is it transmitted? What's its portal of exit? So it comes out of people through their secretions, either secretions, respiratory, or excretions. We know it can be in stool as well. How does it get around? So we have these various, what we call modes of transmission. How does it enter a person? So in this situation, we're all concerned about the nose, the mouth, and the eyes. So we're, healthcare workers are wearing masks and N95 respirators and goggles. And we're trying to get the public to really buy into this everywhere, that if we just would wear the mask for a period of time, we really could stop the transmission. I'll get back to that in a moment, why that's of concern. And where are the reservoirs? Where does this live if it does survive in the environment? So we do know that it lasts for hours on cardboard, stainless steel, in the air. So that's the key, is looking at what we call modes of transmission. We have direct transfer, like a bloodborne pathogen. You directly get in touch with somebody and you get it transmitted to you. You have indirect, where that's part of our job in infection control, is indirect transmission of, like, say, MRSA, C. difficile on environmental equipment that gets transmitted indirectly. Then we have droplet. And so this has been considered a droplet condition, but now we know that we have what are called small particle air transmission. So the droplets that come out when you're speaking, singing, yelling, coughing, or sneezing, usually typically go out 3 to 6 feet, drop by gravity to the earth. And so we would put them in a private room, and we would all wear masks for things like influenza or bacterial meningitis, pertussis. And we thought SARS, that this would be a droplet. Well, unfortunately, the clusters that we saw, some clusters, a big outbreak among a choir, in churches, in restaurants, in homes. We started to see, not in hospitals, interestingly enough. There are no hospital outbreaks of SARS-CoV. Some of the healthcare workers got it, but we haven't had major outbreaks in hospitals. It's been in small contained spaces. We have a lot of people, and we now know that it's the asymptomatics in that pre-infectious period where we don't even know they have it. And so either mild symptoms or they're absolutely asymptomatic, that's when these small particle aerosols are most generated. Once a person's infected, they've found that they really don't generate those. And many of them are on ventilators. So think of a ventilator that's got everything contained. We're suctioning them. We're taking those secretions out. They're not coughing in our face. They're all contained. So WHO did come out and said that they support the concept that this is droplet and airborne. And what that does, it changes our approach for infection prevention. We typically, if somebody had tuberculosis, chickenpox, measles, those are airborne diseases, we'd put them in a negative pressure isolation room. We would have, you know, the room being sucked out the air so many times per hour, like at least 12. We would all wear N95 respirators. I mean, there's a whole different set of engineering controls we do for that kind of a condition. So it does help direct some of the infection prevention measures by saying that in some situations, we have to look at better ventilation, maybe the use of HEPA filters, maybe the use of UV lights. That's what WHO did finally come out and say. There are some things that we can do, like prevent overcrowding, you know, not having people clustered together in bars or a theater or a concert. I mean, that's kind of where it helps us to say we've got to continue not to have big groups of people in a closed space, because we just don't know who has it, who's transmitting it. Because we had what are called aerosol generating procedure, you might see that acronym AGP, aerosol generating procedures like intubation, suctioning, nebulizers, anything that was going to spew secretions around. So they already started to, work with ventilation and make rooms negative. In an ICU, your air is positive. That's the other thing we have to look at it. Which place needs to be negative, like the decontamination of central processing has to be negative pressure. And then the clean side has to be positive pressure. Well, ICUs were always positive pressure. And so in some of these situations, they either had to bring in these units that would filter the air. Some of them go through HEPA filter and a UV light. There's one in particular, a great product that has been used for orthopedic surgery. But they started to use these to control this virus that spread through the air, because the whole unit is in positive pressure. And so those are some of the challenges that some of them actually had to convert with plant operations, the ventilation to be more negative to get the air out. I don't think in hospitals per se, a lot of this, making sure that we have clean indoor air and also get more mix of outdoor air in and not recirculate air as much. That's created some challenges for hospitals that were very tight. Back in the old days, they made hospitals like that to conserve energy. And unfortunately, I remember this back in the late 80s, early 90s, when we had first the bloodborne pathogen situation. We used latex gloves and they were covered with powder. And what was happening is because the air was not circulating the powder out, they were inhaling it, and healthcare workers got allergic, to latex. And some of them lost their careers. I mean, they just, would go into anaphylaxis. So that's the key thing, is why we have to work with departments like a plant operations and ventilation and making sure that all of that is, flowing the right way. I mean, right now they're all using the PPE, they're N95s, everybody's wearing masks. I mean, I was at a hospital yesterday with my mother, and yes, not only you have a mask, we have to have their mask. We had to take our personal masks off and put a clean one on. Right. So you can imagine the amount of PPE we're all going through in healthcare because of that reason. So it didn't affect them. Where this is going to have more impact is in the environment, outside. And what I said earlier, the justification that we cannot have, like we've had in the past, large groups of people together, at least right now until this thing settles down. SARS-CoV-1 took 2 years, 2002 to 2004, I think was the years. So we just don't know. We don't know if this is going to peter out like it did, or is this going to be with us like influenza? Just time will tell. So I think that's the justification. No bars being opened up, and making sure they have masks on if they are going to a church, or having drive-in movie theaters now. It's just life is changing.
Well, what's your educated guess of how long it's going to last, or do you want to render an educated guess?
Sorry, we haven't had time hearing you.
What would your educated guess be about how long this whole matter. So do you want to?
Absolutely. We have no idea. That's what's so frustrating when you have an outbreak.
Yeah.
I mean, I've dealt in my career, which has been more than 40 years in this field. It's been my entire nursing career. Since I was 20, I've done infection control. So I've been through many outbreaks. And, you know, Ebola was one thing. That was a very direct contact kind of a disease and devastating. I mean, I kind of say to people, we're lucky that it's not Ebola, you know, but we just don't know whether this is going to establish itself, because this is a different virus than SARS-CoV-1. You know, the way that this attacks certain proteins in the body, the ACE1 proteins, and they are, most of all your organs aligned with this. So that's why you're seeing this virus is attacking the brain, the liver, the GI system, not just the lungs. And it has, you know, problems with the blood, you know, red blood cells. So it's different. And that's the thing we don't know. We know that some companies now are hiring infection preventionists. Big corporations are hiring them so that they can help them put into place their policies. I've even consulted for police departments, the hotel industry, 2 very large global companies. We've been doing a lot of work outside the hospital, trying to help guide them and develop policies or write newsletters and do webinars and so forth for their employees. So yeah, there'll be more and more out in working with industry. Absolutely.
Maureen Spencer, thank you so much for visiting
thank you.
Control today. Truly appreciate it.
Thank you, Frank.